Hello, and welcome to this overview of ways to maximize your savings under the medical plans.
There is no doubt that medical costs continue to rise. So how can you reduce your costs? First and foremost, improving your health and wellness through diet, exercise, and disease management will also reduce your need for medical care. Studies show anywhere from 60 to 80% of medical costs are related to lifestyle diseases. You can also utilize more efficient care, such as BSSP's health and wellness centers. Consider becoming a medical consumer and shopping for your care. Be sure to utilize only network providers and use Anthem's tool to estimate your costs. For generic prescriptions, get them filled at Costco. And when you can't access the health and wellness centers, try MD Live.
Overpriced healthcare results in higher premiums and people moving to benefit plans with higher out-of-pocket costs. As you can see in our example of a screening colonoscopy, costs vary greatly from one facility to another for the same service and do not correlate to quality of care. We look for value when shopping for other things. Why not medical care?
Let's look at the difference between a hospital and an ambulatory surgery center. The same outpatient procedures cost much more at hospitals. Facility fees at a hospital can be several times more expensive than an ambulatory surgery center where they perform the same service on the same patient, by the same provider, and using the same equipment, medication, and supplies. Hospitals also don't guarantee higher quality outcomes. Ambulatory surgery centers are often more specialized, are high-volume facilities, have lower infection rates, and often provide shorter check-in, wait time, and discharge times. If you use an ambulatory surgery center, there is no benefit change. If you use a network outpatient or hospital facility, you will be responsible for the regular deductible and coinsurance of your plan, plus any amount by which the facility charge exceeds the maximum benefit below. The value-based side of care benefit applies to facility fees only. The fees paid to physicians and other practitioners who assist in the procedures, such as anesthesiologists or radiologists, are not affected by this benefit change and will be limited to your out-of-pocket maximums. In the following cases, a pre-service exception may be granted. If the physician provides clinical justification for using a hospital, if the member lives more than 30 miles from an ASC, if a procedure cannot be scheduled in a medically appropriate manner due to the available ASC not having capacity, and in the case of an emergency. Before receiving these services, please contact the customer service number on your ID card for more information.
Back to our example of a colonoscopy in Butte County, you will pay facility charges in excess of $1,500 with no credit for excess charges toward your out-of-pocket limits if your procedure is performed at a hospital-based facility rather than an ambulatory surgery center such as a Skyway Surgery Center. Please note, even though the facility charges at Skyway Surgery Center exceed the $1,500 benefit maximum for a colonoscopy, you will not be responsible for the excess charges because the procedure is being performed at a designated ambulatory surgery center. Certain non-emergent surgeries are covered only at Blue Distinction Centers or Blue Distinction Plus Centers and Centers of Medical Excellence. These facilities pass a rigorous review of processes and performance, which leads to fewer complications, fewer readmissions, and higher survival rates for patients. The surgeries that fall under the Blue Distinction or Blue Distinction Plus requirement are bariatric surgery, routine hip and knee replacements, and cervical and lumbar spine surgeries. The Blue Distinction or Blue Distinction Plus facilities in Butte County for bariatric surgery, routine hip and knee replacements, and spinal surgery is Enloe Hospital. Organ and tissue transplants must be performed at a center of medical excellence. Before scheduling any of these procedures, please confirm if your surgeon has privileges at a hospital with one of the required designations before your procedure. For a list of Blue Distinction Centers and Centers of Medical Excellence outside of Butte County, please visit www.anthem.com/ca/CISC, click Menu, Find Care, and scroll down to the Blue Distinction Centers and Centers of Medical Excellence section of the webpage. When receiving services from a non-network provider, generally plan payment is limited. The following services are not covered under the plan when they are received by a non-network provider: diagnostic services such as x-rays, radiology, lab work, and other tests, physical medicine such as chiropractic or physical therapy services, and durable medical equipment and medical supplies. This means you may be responsible for 100% of the billed charges, and payment is not credited to your plan's out-of-pocket limits. There are exceptions to the limitations with non-network providers in situations such as emergencies, labs or tests that are ordered from within a network hospital, and anesthesiology services from within a network hospital. Contact customer service to ensure the highest claim payment in these situations. Additional plan provisions to be aware of is the physical medicine benefit is administered by American Specialty Health. This includes physical therapy, occupational therapy, speech therapy, and chiropractic care. There is no approval needed for the first evaluation, and your initial approval is limited to 5 visits. Additional visits are subject to medical necessity review and prior authorization by American Specialty Health. Acupuncture is limited to 12 network visits per year, and Walgreens is not a covered pharmacy.
Thank you for watching this presentation. We hope you found it helpful and ask that you take a few minutes to watch our other videos as well. Please contact us with any additional questions or suggestions you may have. Take care.